All right. Well, thank you all for joining us today. We really hope you stay on the line for our town hall. We have a lot of updates, including updates on the new Baraboo Clinic and East Clinic activations, and also the activation of our new parking ramp. We'll have an update on the PACT Act, and we'll talk about community events that are coming in the near future. We're also going to share some guidelines for how we can partner with you to make the most of your healthcare visits. So we have a lot to cover on the town hall, and of course, we'll also get to your questions and answers. My name is Abe Rabinowitz. I'm the Associate Director of the hospital, and I'll be moderating this afternoon's call. Today, we're fortunate to have a panel of our VA leadership team here to answer your questions and to provide those program updates I mentioned. Please do stay on the line this afternoon, and we encourage you to participate in the question and answer session that will follow. If you would like to ask a question, all you have to do is press a 0 on your phone at any point during the call, and you'll be connected with the staff person who will take your question and put you in the queue to speak with our panel. The Q&A session will be toward the end of the call, but you can press 0 at any time to get in the queue and get your question prepared for our team. We usually don't get to all of our questions, but you will have the opportunity to leave us a voicemail at the end of the call so we can follow up with you if we're not able to get to your question. If you do get cut off from the call, unfortunately, there is not an easy way to rejoin, so please do stay on the line. And please, when asking your question, avoid disclosing personal health information. We want to make sure that we protect all veterans' privacy as we answer your questions. As we begin the call today, I wanted to share some introductory comments on behalf of our leadership team. First, we always look forward to these telethon halls because it gives us the opportunity to reach out to so many veterans at the same time, to provide updates about what's happening at the hospital, and to share information on our programs, services, and events, all designed to improve veterans' healthcare experience. Today, we have many exciting updates to share with you, but before we get to those updates, we want to discuss national news stories you may have heard about budget constraints throughout VA. Those budget constraints are a product of the significant increases in our budget to support our response to COVID, implementation of the Mission Act, and implementation of the PACT Act. Those increases provide a level of resource investment that was not sustainable post-COVID and after initial implementation of those programs. At our own VA here in Madison, our staffing has increased over 25% in the last 5 years, which has allowed us an amazing opportunity to expand the scope and intensity of services we provide. However, we have reached a point where we need to begin tapering off that level of growth and finding a more sustainable operating level. Recognizing the need to address this challenge, we're taking the opportunity to flatten our growth curve and right-size our resources to best serve you. Our goal during this period is for that to have as little impact as possible on the day-to-day services you receive. And right now, I'm confident that we're doing an excellent job of that. In fact, it's our aim to continue to improve services while returning added value to veterans and taxpayers while we make those changes. As you listen to updates today about new services we offer, outreach events we'll engage in, and new eligibility opportunities, we hope you consider informally joining our outreach team and encouraging fellow veterans who may not be engaged with us to choose VA as their healthcare provider. We strive to earn the trust of all of the veterans we serve, and we hope we've earned yours so you can make an affirmative and positive referral of our services to your fellow veterans. And if we haven't earned that trust, we'll certainly work toward that every day, as that is our mission and why we are here. So we wanted to share that message on behalf of our leadership team, and that provides a really nice segue into updates about our 3 exciting activations pending for this summer and fall. We're expanding care sites. So here with us to talk about those expansions and activations is our Chief Strategy and Planning Officer, Crystal Warren. Crystal.
Well, thank you, Abe. Hello, everybody. Our first update is about the new Baraboo CFAS, which is nearing completion and will begin providing care at our new clinic on July 1st. This clinic is in a brand new building, especially designed for our clinic, and it's located at 414 State Road 136, which is next to Anytime Fitness and the BP gas station. Now, when it opens on July 1st, the clinic will be double the size of our existing clinic, expanding to 10,000 square feet, and will be staffed by 30 VA employees. It provides more space that we need for our 4 primary care teams. It expands the space for physical and occupational therapy and provides additional telehealth rooms. We're also going to have an additional conference room for our group wellness classes, and we'll extend our administrative space so we can better serve you. We are planning to schedule an open house soon after the clinic opens our doors, so we'll let you know once that's scheduled. Second, we're also excited that our brand new Madison East VA clinic will be opening for patient care on July 10th. This clinic is located at 4904 East Park Boulevard in Madison. It's on the east side in the American Center development near the intersection of Interstate 9094 and Highway 151. The East Clinic is a new site of care that will offer access to services that some of you, especially those who receive care at Beaver Dam and West Clinic, may find more convenient than coming to the main hospital campus for. The clinic will provide primary care, including a dedicated women's health primary care team, physical and occupational therapy, nutrition services, including a healthy teaching kitchen, mental health, telehealth, blood draw, radiology, x-ray, and whole health services. The new East Clinic will be staffed with several providers that are currently located at our West Clinic. And our plan is for veterans to follow their providers to the assigned location. And the first round of letters alerting veterans of their provider's location was sent in early March, and we just sent out a second round of letters in the last couple weeks and want to make sure that all veterans are aware of and are planning for this new clinic. These letters will remind veterans of their provider's location and how to request a change in provider or clinic location. We are also planning a public open house for the East Clinic, and we'll let everyone know once that's scheduled. Also wanted to mention that the East Clinic webpage is now live and includes answers to frequently asked questions. Now, once East opens, our current West Clinic will continue serving veterans. West Clinic services will include 6 primary care teams, including a women's health team. West Clinic will also add more whole health offerings and will continue to offer blood draw, teledermatology, and integrated mental health. And last, while perhaps not as exciting as major outpatient clinic expansion, we are so excited to be nearing the completion of a brand new employee parking ramp on our main hospital campus. This new parking ramp will enable free parking for all of our employees while expanding parking availability for veterans and visitors. The parking ramp is currently slated for a September opening and should significantly ease our parking shortages that we're currently experiencing at our hospital. And at a minimum, this will ease stress amongst our staff, which we're confident will increase their satisfaction and the quality of care for all of you. And we want to reiterate, if you know veterans who may not be getting their care with the VA, please encourage them to check out our new offerings and their eligibility for care. The first step to do this is to contact our eligibility department at 608-256-1901 and by dialing extension 17038. It's truly our honor to serve veterans, and we always want the number who choose VA care to grow.
Thank you very much, Crystal. And it is exciting to have 3 pretty big activations coming up, 2 of which significantly expand veteran care services. So while we're talking about expansions, we also want to make sure all veterans are aware of eligibility expansion offered through the PACT Act. So here to talk about that expansion is our Chief Patient Administration Services, Liana Torres. Liana.
Good afternoon. If you haven't heard, beginning March 5th, 2024, veterans exposed to toxins and other hazards while serving our country are eligible to enroll directly in VA health care without first applying for VA benefits as part of the PACT Act. Veterans who believe they were exposed to burn pits, Agent Orange, chemicals, nuclear weapons, or other toxins while serving might be eligible. It also includes veterans who never deployed or were exposed to toxins or hazards while training or on active duty here at home by working with chemicals, pesticides, lead, asbestos, certain paints, nuclear weapons, x-rays, and more. Many veterans hesitate to reach out to VA if they don't have immediate health concerns but it's important for them to get established now before they need the care. We're proud of our staff who are dedicated to meeting our veterans' healthcare needs and who have earned a 94% trust score from those we serve in our catchment area. There are many veterans who don't receive their care at the VA, opting for other options. We encourage you to share the care and suggest those veterans to reach out to VA for their healthcare needs to get established earlier rather than later so we can provide the best care possible when veterans need it. So we're actively encouraging all veterans, don't wait, apply for the care you deserve at va.gov/PAC and choose VA as your trusted provider. Please encourage your fellow veterans to do the same. Again, that is va.gov/PAC. Thanks, Dave. Now back to you.
Thank you, Liana. Really appreciate that update and want to encourage all veterans to explore their PACT Act eligibility, both for healthcare and for benefits. Before we move to our next presenter, we do want to ask a few polling questions. So you can respond to these polling questions just by using the numbers on your phone, and then we can tabulate the results and get some feedback from you. Our first polling question is asking, how many of you know a veteran that may be eligible for care through the PACT Act but is not using VA for care? Press 1 if you know a veteran who may be eligible, and press 2 if you're not sure or do not know a veteran who may be eligible. So we see the responses coming in here, so thank you to all of you who are responding. So it seems like about a quarter of you know somebody who may be eligible for VA care, and we would encourage you to encourage them to explore their eligibility for benefits through the PACT Act, because it really is an important resource for veterans who may not be connected with VA care or benefits to get connected. Our second question is a follow-on question, because we know all of you who are veterans who are using us for care. The question is, as a veteran who currently uses VA care, how likely are you to recommend VA healthcare services to another veteran? Press 1 if you would strongly recommend VA healthcare services. Press 2 if you would recommend VA care with some reservations. And press 3 if you would not recommend VA healthcare services. And we do really appreciate this feedback, so thank you to all who are responding to the question. Over 200 so far, so thank you all. And we're very happy that about 80% of you are saying that you would strongly recommend VA, so thank you very much for that positive feedback. We'll continue to make sure that we meet your expectations. There's another about 18% that would recommend VA care with some reservations, and we will try to do what we can to bring you over to that 80% that would recommend us. And there are just a small fraction who would not recommend VA services. And certainly for those folks, you know, we look forward to finding out how we can better meet your expectations moving forward. So thank you, everyone, very much for that feedback. It means a lot to hear from you. And certainly one of the themes that I think we've been trying to subtly push here is how important it is that veterans recommend other veterans for VA services. So please do, if you feel comfortable doing so, let your fellow veterans know about the services that we provide here and their opportunities to evaluate their eligibility through the PACT Act and other authorizations. So next on our agenda, we want to continue the conversation about trust and reliability by talking about ways that we can work together with you to ensure that you're engaged in and maximize the value of your care. So here to talk about that is our Chief of Primary Care, Rochelle Carlson. Rochelle.
Thank you, Abe. I appreciate this opportunity to engage veterans in partnership to ensure we make the most out of the appointment time we have together. Planning ahead helps us to make sure we get the most out of our appointment time. It also helps us to maximize provider time so that we can see as many veterans as we can and minimize wait times for care. Some of the key things we encourage all veterans to do as you prepare for your visit are follow the instructions for arrival that you received when making the appointment or in your appointment letter, and arrive a little early. Most of the time, we ask patients to come about 15 to 30 minutes before their appointment time. We will do our best to not make you wait, but arriving early gives us the best possible chance to keep our appointments on time and avoid waits. Ensure you have completed any ordered lab work before your visit. Make sure to update your demographic information and insurance at check-in so we have your most current contact and insurance information. Also, bring a family member or caregiver with you if you need one, and make sure you plan your transportation. And be ready to discuss any concerns you have with your provider. And remember to share anything that causes you stress or that you feel specifically important to you. And do not hesitate to remind us about healthcare concerns where you expect follow-up. We try not to miss anything, but you can help us make sure we don't by reminding us of any follow-up orders or concerns you are tracking to ensure we address them. By following these guidelines, we can make the most out of your appointment and ensure we are working with you to engage positively in your care. Also, there are additional tools to stay on top of your healthcare needs, and we strongly encourage you to use these tools. One is to sign up for My Healthy Vet and to use it to engage with your PAC team. Also, utilize our nurse triage phone line to report any healthcare concerns you are experiencing to our nurse. And this nurse can help you connect with clinic services at a time in the future, but the nurse can also give you information when clinic services are not available. That nurse triage line is 888-598-7793, and it is available 24 hours a day, 7 days a week. And also, consider using our telehealth services to expand options for your care delivery. It's truly amazing to see how our healthcare services are expanding and changing to meet your needs. And it is critically important to us as your healthcare provider that you engage with us in managing your care and keeping your health information current. Thank you for your time this afternoon and for choosing us to provide your healthcare services.
Thank you very much, Rochelle, and appreciate everybody paying attention to those reminders to help make the most out of your healthcare time with us. Partnership with your healthcare and engagement are critically important to our success and our ability to treat you, so thank you for your attention to those. Before we get to Q&A, and we have several questions coming in, so thank you everybody who's already posted a question. We do want to share with you a few external events we're excited to promote over the next several months. And here with us to promote those events is our Chief of Community Relations, Joe Naylor. Joe.
Thank you, Abe, and good afternoon, everyone. Yes, we have quite a few events that we'll be participating in the community in the next few months, and we're excited to share those with you, and we hope to see you at some of them. As most of you know, June is LGBTQ plus Pride Month, so we have a number of events in our Benson County area that we'll be participating in coming up this June. The first is the Rockford Pride Month in downtown Rockford, and that will be on June 1st. The second event will be the Janesville Benefits Fair at the Janesville Elks Lodge. We hope to see you there. That'll be 11 to 5 p.m. and always a great event there in Janesville. We'll be participating in the Freeport Pride Picnic at St. John's Lutheran Church in Freeport. In addition, we also have the Beaver Dam Pride Fest on the 29th of June. Moving past that, we have the 25th of May will be at the Miracle Mile Rockford Car Show at Don Carter Lanes. And then coming back to Madison, we'll be celebrating Juneteenth at the Madison Juneteenth event at Penn Park right here in Madison. That'll be on the 15th. One of the larger events that we're working on in coordination with our County Veteran Service Officer partners and the Fort Atkinson Club is a regional veterans block party that we'll be hosting on the 29th of June at the Fort Atkinson Club and American Legion right on the river in Fort Atkinson, and that will be from 11 to 5 p.m. So we hope to see you there at that event. And finally, the last two events that we have in July, that the larger events, will be the Dane County Fair, specifically the Veterans Appreciation Day on July 18th, and that will be all day. So come see us there. And then rounding out July, we have the Madison Vet Fest with the Madison Mallards. Always a great event, an annual event that we've been participating in for about 4 years now. And that will be centered on a Madison Mallards game as well as their new softball team. So that will be on the 26th of July at the Mallards Field. So we hope to see you there and hope to see you at some of the other events. We'll see you then. Thank you, Abe.
All right, thank you, Joe. Obviously, a lot of stuff going on in community outreach and ways to engage with us in the community and to encourage others to do so as well. You probably noticed a little bit of a theme about outreach kind of throughout this whole presentation, and again, it's because we are working to try to connect as many veterans as we can with the healthcare benefits that you've earned. And a great way to stay on top of the many events that Joe just walked through is to sign up for our Facebook page, because we post all of those calendar events to our Facebook page so that you can always track what's going on at the hospital and participate in those that you can. So now we are at the end of our updates, and we can move to your questions. And the first person that we have in the queue is Terry from Baraboo. Terry, please go ahead with your question. Just trying again. The first caller in the queue for a question is Terry from Baraboo. Terry, if you're on the line, can you go ahead and let us know your question?
Yes, my question is, if I change from the Madison VA to the Baraboo VA, do I get all new doctors, and do I have to go through all the changes that I would have to make if I did get new doctors?
Hi, Terry. My name is Rochelle Carlson, and I'm the Chief of the Primary Care Service. So if you switch to the Baraboo CBOC, you would receive a new primary care provider. However, you would retain all of your current specialty doctors that you would have in Madison. What's really great about our VA system is we're all one, and we're connected with our medical record and all of our information. So even though you would be changing primary care providers, all of your information is there, and they would be able to follow and understand what's going on with your care.
Great question, Terry. Thank you very much, and thank you, Rochelle. Our next caller is Leonard from Stevens Point. Leonard, please go ahead with your question.
Yes, my question is, at the new Madison East facility, will that facility be processing travel reimbursement papers over there? Because and online is out of the question for me. So it would avoid me having to go back to the main center to file for travel. So my question is, will Madison East be able to do that?
Hey, good afternoon, Mr. Leonard. My name is Kent Hall. I'm the Associate Chief of Health Administration Services. So for our veterans that are going to our CBOC, East Clinic, West Clinic, and of surrounding areas, whenever they do finish their appointment, they can file for their travel either on a paper claim, and those that have the capabilities, we do encourage them to do it online. From there, the CBOCs have instructions to be able to send that over to the main hospital to process these travel claims as if these veterans were at the main facility. And we encourage any veterans that do have questions about their travel claims to give us a call on our number. It is 608-256-1901, and that extension is 11919, and that's for our travel department. And anybody there should be able to help answer any questions you have in regards to that. And again, the number is 608-256-1901, extension 11919.
All right, thank you, Kent. And Leonard, we know that some folks have had trouble with our new BTS3 online travel reimbursement system, so understand your frustration, but hope at some point we can get you to give it a try, because it is the fastest way for us to process your travel claims, even if in the beginning it may not be the most convenient. So thank you for the question. The next caller that we have on the line is Steve from Montello. Steve, go ahead with your question.
Yes, good afternoon. My question is, I'm a snowbird. I spend summers here in Montello and winters in Punta Gorda, Florida. So my primary, since Florida is my primary address, my primary is down there in Port Charlotte, VA. My question is, being up here for the summer, I'm here April to October. If I have an issue, do I have to, and I want to go to Baraboo, that's probably my best bet. Do I have to register? I kind of got an answer from the first guy, Terry. Do I get like a second primary, or can I just go there as a walk-in and see somebody and they can have my records on the computer or whatever?
Hi, Steve. This is Stephanie from Social Work. First of all, congratulations on being a snowbird and missing all of the winter weather here in Wisconsin. I'm quite jealous of that fact, and maybe down the road that'll be in my plans. But the VA has a lot of veterans who are snowbirds and a lot of veterans that travel, including overseas. And so we do have a traveling veteran coordinator program that is at every single VA. And so the way that you coordinate ahead of time before there's an emergency, before you have an urgent issue, is to contact your VA down in Florida and your primary care provider and ask them to put in a consult to the traveling veteran coordinator. And then that person who's in that position down in Florida will get a hold of the Madison traveling veteran coordinator or whatever traveling coordinator is closest to where you're traveling to kind of prearrange some visits if you have routine visits. Now, of course, if an emergency happens, definitely if it's a true emergency, we'd want you to call 911. But otherwise, we do have, and of course I don't have it memorized, our telephone triage number. I'm sure we said it earlier in the call. So pause while somebody finds that for me. But you can always call the nurse triage phone line number. That's 888-598-7793. That's available 24/7. So if it's a urgent healthcare concern or any healthcare concern, you can always call them as well. But I would recommend getting hooked up with that traveling veteran coordinator so that you can be prepared and kind of figure out what your options would be up here, and that we know of you and that you're coming, and we can maybe get you loaded into our system to make it a little bit smoother for you.
Yeah, thank you, Stephanie, and thanks for the question. Again, all VAs have traveling veteran coordinators, so whatever your home VA is, and if your home VA is Madison, you can always contact our traveling veteran coordinator to ask for a similar kind of assessment and for a consult to a place where you may be traveling to. And again, a great reminder about the nurse triage line, because that is available 24/7 for veterans. So thank you, Stephanie. The next caller we have is Philip from Monroe. Philip, you're on the line.
Yes. Okay. I had two questions. The first one has to do with cataract surgery. Can I get cataract surgery through the VA hospital in Madison?
Hi, Philip. This is Stephanie again. So yes, we do provide cataract surgeries here at the Madison VA. So what we'd want to do is to have your primary care provider put in a consult to our eye doctors, ophthalmology or optometry. Those are very difficult words to say sometimes. And then we could evaluate whether or not you need cataract surgery. And then the other thing we would talk about is availability on scheduling that and whether or not you have that done here, or if we would have to refer you out to the community based on timelines. So yes, we do cataract surgeries here. We do them quite often, and so that is a service we do provide. What is your second question?
My second question is, I continue to hear that I'm safest to carry both Medicare insurance and have the VA as my provider. And that's costing me, I don't know, pretty close to $200 a month to have Medicare insurance. And the statement from the VA rep in Greene County was that there's no telling if the VA medical facilities will be around forever.
Yeah, this is Stephanie again. I think that's a really common question for our veterans who have dual eligibility. They are veterans, so they get benefits through us, or they're eligible for benefits through us. And then, of course, as taxpayers, veterans have eligibility for other federal and state and local programs. And so I really think it is a personal choice, and we certainly can't predict the future. I would think it would be unfortunate if the VA wasn't around, and I guess I don't necessarily see that happening, but that's just my opinion. So I do think it's certainly your personal choice on whether or not you keep Medicare. There are things you can get through Medicare that you can't necessarily get through the VA, and there are things that you can get at the VA that you can't get through Medicare. And so again, it's your choice on that. If you wanted to talk to someone here about it a little bit further, our social workers here have a pretty good handle on all of the different types of things and can certainly provide you all of the information so you can make an informed decision. So I'm going to give you the social work office phone number so you can call and then have a social worker call you back. So that number is 608-280-7085. 608-280-7085.
And thank you, Philip, and thank you, Stephanie. I mean, I know that everybody in this room who dedicates their time and professional abilities wants to make sure that we're here for you guys for as long as we possibly can be. So, but of course, it is true that we can't entirely predict the future. So thank you for your question, Philip. The next caller we have is Elmer from Wisconsin Rapids. Elmer. Elmer, do we have you on the line?
Yes, you do.
Oh, excellent. Welcome to the call. Do you have a question, sir?
No, I was just wondering how come the VA. I live in Wisconsin Rapids, and I have to go clear to Toma for X-rays.
Hi, it's Stephanie again from Social Work. Elmer, do you have primary care through Wisconsin Rapids?
Yes, I do.
Yeah, so what I would do if I was you is I would talk to my primary care provider about what you need the x-ray for, or whoever was ordering that x-ray, and try to advocate for yourself that if you can't get from, I don't know how far it is from Wisconsin Rapids to Toma, but perhaps there's a closer place that they could make a referral to. So I'm not going to speak for the Toma VA and say that you're automatically eligible for a closer x-ray, because that would maybe pan out to not be true. But that's what I would do if I were you. I would talk to the person who's ordering the x-ray and see if they can put a referral and figure out if there is a closer place that the VA would pay for you to get that x-ray.
Okay. Sounds good. Thank you.
Thank you, Elmer. Appreciate the question. The next caller we have is Jesse. Jesse, you're on the line.
Afternoon. Wanted to ask about if the Madison, Wisconsin location is looking to add in a transplant package for people who are coming in from out of the area so we could get a better idea of what to expect when we're in the area, at the hospital, post-recovery, things of that nature.
Great question, Jesse. One, I know that it's very easy to explore our webpage for transplant. We have information on our transplant services. If you just Google Madison VA transplant, it will take you right to our transplant programs page. We also have transplant coordinators who would be happy to connect with you and give you information on the program. You can call our transplant office by dialing 608-280-7072. And I think those are probably the two best ways to, I guess, begin asking questions about the transplant services we offer here in Madison. But we are very proud to offer a number of transplant programs here, and encourage you to look into them either through the website or by calling. Thank you. The next caller we have is Albert from Baraboo. Albert, go ahead with your question.
Yes, my question is, are we going to have more providers in the new Madison or the new Baraboo facility? And I'm wondering, we're expanding everywhere, seems like, in Madison, but we don't seem to get more providers in Madison or in Baraboo, and seems like it takes an awful long time just to get an appointment in Baraboo.
So, hi, Albert. This is Rochelle Carlson. I'm the chief of the primary care service, and I'm sorry to hear that you've been having difficulty getting an appointment in Baraboo. The good news is that with our new facility, there will be more space there, and we've had a lot of space restrictions at our current Baraboo facility, which has limited some of our access. So with that expanded space, we'll have the same number of providers, but they will be have more space to work out of, available more days, and we are changing some of those appointment times around to make it easier for you to get in. So with that change, you should start to see it easier to get an appointment.
Thank you, Rochelle, and we're certainly looking forward to that new facility in Baraboo. Next caller is Richard from Berlin. Richard, go ahead with your question. Richard, are you on the line with your question?
I had my cottage graduate.
I think we might have lost Richard for a second, so we're going to go on to the next question. The next caller is Sean from Sun Prairie.
Hello.
Hey, Sean, go ahead with your question.
Yes, I've been receiving VA benefits for asthma since I got out of the military, and I just recently applied for the burn pit clause. And after the evaluation, my VA benefits didn't change because of the exposure. Is that the way it's supposed to work, or?
Hey, Sean, this is Dr. Marsh, the Chief of Staff here. So first of all, thank you for your service, and we get a lot of questions about the burn pit exposures and what that will mean for your benefits. And certainly, some of this stuff is very individualized, and so you would need to talk to one of the representatives from the VBA about it. But I can tell you that if you were already service-connected for asthma and you went back and said you wanted to claim other types of burn pit exposure conditions, they would still evaluate the asthma typically based on what the rating schedules allow for. So there wouldn't be any difference for that particular condition, whether it came from burn pit or it came from something else. So it sounds like maybe it was the same.
Okay. All right. Thank you.
Yep. Thank you, Dr. Marsh. Next caller is Robert from Hill Point area. Robert, go ahead with your question.
Yes, hello. I'm a retired veteran. and I'm currently the only benefits I receive at VA are for hearing, which I have a 10% disability for. Otherwise, I receive my health care through Medicare and TRICARE for life. And my question is about prescriptions primarily. When I first retired, prescriptions cost us nothing. Now they're $13 every 3 months. The only other alternative I know of is to go to an active duty base that has a working pharmacy. Is there any other alternative available to me to get my prescriptions at a reduced cost?
Hi, Robert. My name is Liana. I'm the Chief of Patient Administration Services, and what I will advise you to do is to call our eligibility department, and they will have you do a means test. They will assist you with that. And what that is basically will analyze your financial situation, we'll fill out some paperwork, and see if you qualify for the exception for the medication copay. So are you ready to write down the number?
Yes, I am. Go ahead.
So the number for the eligibility department is 608-256-1901, 608-256-1901, extension 17038. Extension 17038. Got it?
Yes, I got it. Thank you very, very much. I appreciate it.
Thank you for the question.
Yes.
Great. Thank you for the question, Robert, and thank you, Liana. Next caller we have in the queue is Dennis. Dennis, go ahead with your question.
Hi, this is Dennis from Berlin, Wisconsin. I have a number of questions, but I only approached 3 today. I used a Beaver Dam clinic, and I got a letter in the mail saying that the physician that I had been seeing there is leaving and would like to know if there's a new physician there. And second question would be, the last time I tried to make an appointment there, calling the number at the clinic, I was referred to a different number to make an appointment with. Is that still the same way? And the third question is, seeing how they're going to open the East Side Clinic in Madison, are there plans on closing the Beaver Dam?
Hi, Dennis. This is Rochelle. I'm the Chief of the Primary Care Service, and I can answer your questions for you. So we do have other providers at the Beaver Dam Clinic, and so you can certainly see a new provider now that your physician has left. As far as the number to call, the main number of the Beaver Dam Clinic is 920-356-9415. And I do want to let you know that some of those calls, even though you're calling the Beaver Dam Clinic, it may go to a bigger scheduling contact clinical center that's part of our vision. And it may be somebody that is part of a bigger group that does the scheduling. And so they will still do the scheduling for Beaver Dam for you. And then as far as with the opening of the East Clinic, we will also continue to have the Beaver Dam Clinic. We will have both sites.
Yeah, we are super excited to be able to offer new services at East while retaining access for veterans in Beaver Dam. So at this point, it's great news to be able to offer additional services for veterans at additional access points. So thank you for your question, Dennis. The next caller we have is Valerie. Valerie, go ahead with your question.
Hello. I had a question about women's wellness checkups. I wondered if there is a gynecologist on staff at the Madison VA, and if you could get your yearly women's wellness exam done there.
Hi, Valerie. This is Rochelle, Chief of Primary Care. And we are able to do women's wellness exams, and we have providers at all of our clinics that are specially trained in women's health and can do the women's exams, and so they don't even need to be gynecologists to do those. However, we do have a gynecologist available at the Madison VA that if further referral is needed to a gynecologist, that those providers can refer to the gynecologist and take care of any additional needs.
Thank you, Rochelle. The next caller we have is John in Edgerton.
Yes, my name is John. I found out last week, April 30th, that I have grade 5 prostate cancer. I have to go for a PET scan at the end of the month. If I find out that the cancer has gone through my body, my family lives in Illinois. I'm wondering if I could get care at the VA hospital, Hines Hospital in Illinois, like kind of transfer there because who knows if I'm going to need chemo or what I might need if the cancer has gone through my body. Can I just, because my family members are all in Illinois and I'm going to Madison VA because I live in Edgerton.
Hi, John. This is Stephanie from social work. First of all, I'm very sad to hear that you've gotten that diagnosis. What a life-changing event, and certainly all understandable that you have a lot of questions running through your mind right now and a lot of what if this happens, what if that happens, and you're going to have to do some planning. I want to let you know that the Madison VA is going to be here for you to help you figure out what your best options are for what you have available for resources. So I would encourage you to call the social work office, and we can have a social worker do a basic assessment and then work with you once you have the medical information. And then our medical team and social work and the nurses, we can all get together and help you come up with the best plan for your treatment. And if that does mean that you need additional help and it would be better for you to be closer to family, we would definitely help you transfer your care to Hines or any other VA so that you could get the care that you needed and then be around your support system, which is going to be very important. So we can most definitely do that. If you want to talk to a social worker about it, that number is 608-280-7085. 608-280-7085. And I wish you the best of luck with your future decisions and treatment.
Thank you for calling, John, and thank you, Stephanie. And John, as Stephanie said, our Madison VA is certainly here for you, and we have folks that will help work with you to make sure that you get the care you need, whether it's here or at Hines. But we appreciate your call. Yes, go ahead, Stephanie.
And I just want to let everybody on the phone know, too, that if you get diagnosed with certain cancers, it's really important for you to also figure out if that cancer was a result of one of your military experience. And so it's really important to remember and just keep that in the back of your mind when you get these diagnoses that there are certain diseases and diagnoses that the VA realizes may have come from service-related service. So just keep that in mind too, John, and then also the other callers on the line.
Thank you, Stephanie. The next caller we have on the line is Mark from Watertown. Mark, you're on the line.
Thank you for taking my call. I watched Secretary McDonough's town hall meetings. And in the May 15th town hall meeting, he stated that the VA primary providers will find the time to complete DBQs for the veterans. What steps will you take to ensure that happens in your area, your hospital?
Hey, Mark, this is Dr. Marsh, the Chief of Staff. So it has been a long-standing policy, VA-wide, that primary care providers or specialty providers can complete those templates. So for those that don't know, the DBQs are disability benefit questionnaires, which are used by the Veterans Benefits Administration to rate conditions. It's a templated medical exam that's done. Certainly, it is something that's been communicated to all the staff here, and we will continue to do so, that providers are able to do that for the veterans who are requesting that. So we will continue to make sure that education is out there. Now, here's the thing. I would tell you that while a provider can fill out a DBQ, they may not say exactly what someone is requesting, right? If in the end it is a professional opinion, a medical opinion, and it may not go along with what you are requesting, and maybe not you, but maybe someone else. So while they can fill it out, they may not fill it out supporting the opinion that you're asking for. That's always a tough thing to hear. It's a negotiation between you and your providers, but that is something that people have to be aware of. In the end, it is a professional medical opinion that's going to be on that form.
All right. Thank you, Dr. Marsh, and thank you, Mark, for that question. We are at the end of our hour, and really want to thank all of you that have stuck on the line with us and raised your questions. We always appreciate this opportunity to connect with you and get those questions answered, and of course to share updates that we have from the hospital. So we do these town halls quarterly. We hope you'll be able to join us for a future one. We really appreciate your time and for choosing us as your healthcare provider. And again, we really encourage everybody out there to connect with veterans who may not be connected with VA, and encourage them to explore their benefits, because we are here for you. We're a healthcare system dedicated to providing and working on providing the healthcare benefits that you've earned through your service. So thank you very much for your time today. We really appreciate it. We wish everybody a happy summer and look forward to talking to you at our next town hall. Thanks again.